Okay. Motorcycle accidents, ATVs, things of that nature, horses, what have you. Right. All right. So, as part of that appendicular skeleton, we have what's referred to as our joints. This is what causes our body to be able to move. Okay, this is where bone comes in contact with another bone. We have what's referred to as a hinge joint. The motion happens on one plane. So, just like our shoulder, there's a very finite amount of movement that shoulder can make. It can only go but so far. Then there's a ball and socket joint, which allows for rotation and bending. Okay, that's a little bit different. The ball and socket joints that you'll typically see are like your knee and your hip. You know, the hip, at the hip, or what's called the acetabular joint, can only go but so far. You bend it too far, it's going to pop out or it's going to break. Okay? So our hinge joint would be like our shoulder, where one fits inside the other, kind of in a almost like a ball and socket, but it's very restrictive in the amount of movement it can make. And our major joints are all ball and socket joints, like the knee, like the elbow, okay? That allow for a little bit more bending and rotation or flexion and extension, okay? When we get to med term, we'll talk more about flexion and extension. Everybody good?
Yes.
Okay. Okay. So in your upper extremities, the upper extremity, we're talking about the shoulder girdle. Okay. The upper extremity is the arms, the forearms, the hands, okay, and of course the fingers. In our shoulder girdle, starting from the sternum itself, okay, you have what's called the sternoclavicular joint. It's actually a piece of costocartilage that forms with that, and then of course it goes from there to the clavicle. Okay, the clavicle is that small bone that sits right here in the front. Okay, this is your first. This is actually the first rib. You cannot feel the rib that sits underneath there. Okay, the rib that sits underneath there, you cannot actually palpate. Okay, then you have what's called the acromioclavicular joint. And it sits right there, what's referred to as the acromion process, which is the shoulder joint, or part of the shoulder joint. Okay. The whole reason for this is that allows for a small amount of movement there, or extension there inside of the shoulder. From there, you have the glenohumeral joint, which is the actual shoulder joint itself, where the ball of the shoulder, or the humerus, fits inside of the glenohumeral joint to allow for movement. The scapula is your shoulder blade. That's what forms the actual structure of your shoulder. And then, of course, you have your humerus. And what you need to know about your humerus is what's referred to as one of the long bones of the body. This is one of the areas where red blood cells are made. Okay? So there are four major bones in the body where that happens. That's the humerus, bilaterally, left and right. And then, of course, your femurs, left and right. And so because of that, when those bones are fractured, it causes significant hypoxia. Can cause you significant trouble breathing, because the area where the red blood cells are made, which help to move oxygen, are no longer able to get into the portions of the body that they need to, or cannot be created in those areas. So you have a decrease in the amount of red blood cells that the body has available at any given time. Okay? Which definitely can cause a problem when it comes to breathing. Okay? Like I said, the sternum itself is made up of 3 parts. The sternum actually also helps with the facilitation of creating red blood cells. And it's very interesting. I always love teaching when I teach CPR that, and you can do the research on it yourself. I did, and it was very interesting to find out that the way that the costocartilage breaks away from the sternum when CPR is being performed is that the sternum itself breaks loose and sits directly over the left ventricle. Okay? And what it does is it compresses primarily the left ventricle. Well, we know the left ventricle is the primary pump of the heart. So it slips down into place, and if you'll notice, when you do CPR, you'll feel your hand slip, and it slips right over the left ventricle to be able to push all the blood throughout the body. Call it intelligent design, call it what you want, but I think it's pretty amazing how it works. Pretty amazing how it works. Okay. In the upper extremity, like I said, the humerus is one of your supporting bones. This is where your red blood cells are made. The forearm itself, and that extends from the glenohumeral joint all the way down to the elbow itself. Okay, and from there it's connected to the radius and ulna. Now you have the radius, and remember we're talking palmar position, palm out. You have the radius where your radial artery runs, the larger bone. And then you have the ulna, and you do have an ulnar artery that runs on the outside of that. So if you truly were to try to palpate, you can palpate an ulnar pulse, but it's very difficult to do. But the radius and the ulna those are the three bones that actually make up the arm. Okay. Then of course we have our wrist and our hand. It's made up of multiple bones, starting at the radius and ulna. From there, you have your carpals, or what's referred to as your metacarpal joints. This is where the actual structure of the hand begins, goes from there into the metacarpals, and the metacarpals are in between the first joint and the actual, between the, I apologize, between the carpals and the metacarpals. That's that first joint. And then from there, you have your phalanges, which are the second and third joint inside the hand. Okay. And remember, how many fingers do we have?
5.
No, you don't.
10.
You have 8.
Oh, and 2 thumbs.
Thank you.
Yeah.
They're very different. The fingers and the thumbs are very different. While they look the same, they have very different structure inside of them. They're all bone, obviously, but they're opposable. And because of the fact they're opposable, they're made to move in an opposite direction, and they're the only finger. While these move anterior, posterior, can move to some degree from side to side, the thumb itself is more of a ball and socket joint, as it has flexion, extension, and some rotation. These fingers barely have just flexion and extension. Okay, so if you look, you have a very small window of lateral movement with these, whereas with your thumb, you have a very different range of motion. Okay, so it's a different type of socket joint. Okay, I always like to point that out because it's very interesting. Like I said, we're one of the few creatures in the animal kingdom that actually have that opposable thumb, so we can grasp things of that nature. Kind of what separates us from, other animals. I'd still like to have bear claws, but that's just me. All right. So then we talk about any questions about any of that? I'm sorry. No. All right. Then we have the pelvis, and the pelvis is a bony ring. There are 3 main bones to the pelvis. The first is the sacrum, like I said, that forms the posterior aspect of it, and that forms the primary portion of the structure, and that's what gives it its strength. Okay? That is what gives it its strength. Then there are 2 bones, okay, inside the pelvis, and the pelvic bone is formed by the fusing of the ilium, the ischium, and the pubis. And the pubis is the frontal portion, okay? The ilium are the side portions, the ischium is the rear portion, and it forms to create the actual pelvic cradle. The interesting thing about the pelvic cradle is, like I said, it's what is commonly referred to as a superstructure, because the way in which it is formed, it supports 60 to 75% of the weight of the entire body. It gives form to the lower body, and it actually supports the form of the upper body. It takes a significant amount of force to break that. Interestingly enough, though, in childbirth, the pelvic cradle actually separates to allow for the baby to pass through the birth canal. So the symphysis pubis, which is there at the front, will actually separate to some degree during childbirth for the baby to be able to pass through, and then it will reattach. Okay. Again, call it what you want, but I think it's very interesting. Okay. There you see you have your ischium, you have the symphysis pubis, which is a cartilage there in the front. Okay. You have the pubis, which is the bones there at the top, the ischium there at the bottom, and the ilium is actually the iliac crest and the ilium are the larger portion, which form the. If you feel your pelvis, you can actually feel that like wing there. That is what's referred to as the iliac crest and the ilium. Okay. The iliac crest is just the top portion, and it's kind of rounded because you obviously wouldn't want a sharp bone sitting up there like that, so it's kind of curved over. And the purpose of that is not only to give shape, but also to give form and give function. And this is what gives the lower portion of the body its movement. Okay. What you also see there is that there are major arteries and veins that run through there. The inferior vena cava comes through there via the femoral vein. The descending aorta sends blood down that way through the descending aorta down into the femoral arteries. Now, this area of the body, just as an FYI, you may want to put a little star next to this. If you were to have a pelvic fracture, you can lose 2 liters of blood into your pelvis and not even know it. Okay? You can lose 2 liters of blood bleeding into the pelvis before you'll have any signs of shock or any symptoms, or you will see any major signs of blood loss. Okay? That is very important to understand. So this is why when we do our head-to-toe assessment, which we'll be talking about in the next chapters coming up, it's so important that we recognize that damage early on, because if we don't, you can have a patient with major injury that goes unchecked, and it won't be very long before you won't have a patient. Okay. Then we have our lower extremities, okay? And this is where the pelvis deviates into the right and left leg. From there we have the femur. This is the largest bone in the body, okay? The femur is what's commonly referred to as our thigh bone. This is the major areas of the body where red blood cells are created. Connects to the pelvic girdle, like I said, with that ball and socket joint, okay? And what that does is that allows for lateral, anterior, and posterior movement, flexion, extension of the legs. Allows us to be able to walk, to be able to run, to be able to crawl, do the things that we do. It's connected to connects the upper leg and lower leg via the patella. So you have 4 bones in place that connect to be able to allow the leg to move. Okay, you have the femur. You have the patella, which sits anterior of the femur, okay, at the knee, and then you have the tibia and the fibula. It's tibia. I like to stress that, not tibula. It's tibia and fibula. The tibia is referred to as the shin bone. This is the bone that sits in the front, okay, and it sits what's referred to as anterior medial, which means it sits in the front and it sits to the inside, okay. Whereas the fibula, or excuse me, anterior lateral, I apologize, anterior is front and outside. Whereas the fibula is inferior medial, okay? So it's to the rear, back, and behind, okay? So tibia is in the front and it's lateral. So it faces kind of outward. Whereas the fibula is behind to the inside, okay? They don't sit straight front to back. They kind of sit at a cant. And the reason for that is for structure. Because when you look at that compared to how it comes down into the foot and allows the foot to move, it makes a lot of sense. Okay? Alright, here it's going to show a picture of it. This is where it comes down into the foot. Alright. So, the Achilles tendon, okay? The Achilles tendon runs down the entire length, posterior aspect of the leg, from the knee down. And the reason for this tendon is allow for flexion and extension of the foot. This, again, provides structure. You have your malleolus, and that is the ball that you feel on the outer and inner aspect of the ankle. This is what forms the ankle. It's what's referred to as the lateral and medial malleolus. Medial being middle or inside, lateral being outside, okay? So when you're looking at this one here, what you're actually looking at is you're looking at the right ankle, okay? Because they're showing you the medial aspect of it. So that's the right side of it, okay? The talus is the main bone that forms the foot, and the calcaneus forms the posterior aspect of the foot. Then you have your navicular, and then you have the medial cuneiform, and these are all the bones, just like the tarsals, or like the carpals. Those are the bones that form the foot, okay? Then you have the metatarsals, which are the beginning of the lower portion of the toe, and then of course you have the phalanges, which are the toe itself, okay? Your ankle, again, is another hinge joint. It only moves but so much. Primarily, it does have some lateral movement, but as you and I both know, if that ankle starts moving lateral, it ain't gonna move like it's supposed to for very long, and you'll end up spraining something. So the primary function of that ankle is anterior-posterior movement. Okay, it's made to rock back and forth. That's pretty much it. It'll move a little bit from side to side to give it a little bit of give, but primarily it's made to move like this, back and forth. Okay. All right, we're going to take a quick break.